There is a huge difference between clinical studies and the real life. Because in clinical studies we have very strict inclusion-exclusion criteria. And unfortunately, it happens very frequently that only 20% of the patients are fitting in these studies. And of course, we are, for a clinical study is okay, because first we have to know if the protocol is working or not. However, if we would like to treat the patients in real life, in private practices, in clinics, everywhere, so we have to consider that variability will be higher, and there are only two, let's say, absolute exclusion criteria, where there are metal implants in the head or the spinal cord. And if the patient, for example, bleeding after stroke because it conducts the current. So, and of course, we don't stimulate during pregnancy, something like this, but it's more a legal issue. The variability is really high. We are different, we have different anatomical structures, the thickness of the bones, the cerebrospinal fluid, different. And we have to individualize stimulation session, but it's not so easy. For that, we need, for example, MRI pictures. We have to stimulate the current flow. We have to think about medication stimulation interactions. So there are plenty of problems. And one more problem, that if we want to repeat the stimulation each day, the patient should come to the clinic each day. So it means it's a lot of stress for the patients, and of course financially it's not optimal. Therefore we are working on it, how the patients can use the stimulator at home.